time. I have two topics. The first topic is on Frontlines in hypermarkets. This discussion about change is where I'm picking up. And the problem that could be useful to study is how to get ahead of the healthcare curve in uncertain and fast-changing markets. So today, the healthcare providers have to think ahead of the curve because the things are changing so fast, and the pandemic is a good example of it. The opportunity here that connects to what we've been doing in marketing has to do with this outside-in and inside-out frontline capabilities, where we can anticipate demand and respond with agility to yield effective outcomes. This topic has received a lot of attention in marketing, but not in the healthcare context. And I think it has a very useful application there currently in these times. And I thought this article from the New York Times, I don't know how many have seen this, on July 15th, exemplifies where this could fit in very nicely. They compared the styles of Dr. Briggs and Dr. Fauci on how they work with data specifically. And they said Briggs is paranoid about getting the data science right. She has a passion for accuracy in frontline data, and she relies on models of prediction. So they talked about how she goes around the White House with lots of charts and graphs and reports on how to read the data, anticipate demand, and respond. Dr. Fauci, on the other hand, they said is pessimistic about data and model prediction, has a preference for ground or frontline stories, and there's a discussion about how he called in the middle of the night all his friends at the hotspots and try to understand what's happening in the emergency centers, who's coming in, and how are the things changing, because he relies on experience or predictions. These two different approaches to how to bring outside in is very well developed in marketing, and I see a direct application for applying this to connect it to the idea of inside out. How do we take this knowledge about the markets and customers and changing behaviors to strategy and bring it down to frontline action so we can respond with agility and anticipate where the curve is going? Fortunately, there are new data sources that I think would be very useful to develop this idea. One simple way is what is being published. And in the New York Times, the entirety of something called the Red Dawn emails were published in April 2020. They can be mined to see how data are interpreted in healthcare and how they are used for these capabilities. There are many companies which are developing these sensors to get initial frontline read on how the markets are changing, how to work with that data, not at the analytics level only, but at the strategy level, is also a very important topic, I think, that is ready in this area. And the fact is the healthcare front lines are shifting, changing with these new diseases and conditions that are hard to predict from past data, and they require an agile response. So I think that's the first topic that I think is very useful to study. The second slide is temporary organizing for public health. This COVID-19 is basically a humanitarian crisis for public health, and there are many that contribute to such a kind of crisis: climate, war, disease, migration, conflict. They all have public health element in them. And the public health has not received that much attention. But marketing, again, has done some interesting work with temporary organizations that I think is very useful, because in this context, many different organizations come together because they have to work together to collaborate to solve an emerging public health crisis. And so the opportunity here is how to channel the collaboration, the collision, and the conflict these organizations may have in temporary organizations to yield effective outcomes at speed. And I mentioned a few pieces published in JM that I think can be directly leveraged for this kind of study: the cause-driven work by Vardarajan Menon, Humphrey's mega marketing piece, and the more recent piece by Hadida and others on temporary marketing organizing. So we have the base to study how to organize temporary organizations and make them effective. but you've not applied them. There's a lot of potential in both data and funding to do it. So the Gates Foundation has emergency response operations as a priority area that they would fund. The Business Roundtable on such topics, they're ready to proceed to participate in it. There's precedence both in management and operations to study public health organizing. In operations, there's something called humanitarian operations management, and MINSPIC did this work with Red Cross in war zones. So I think there is an interest to bring it into our field. Marketing has a specific interest in interorganizational interest, and I think that can be applied very effectively in handling this. That data are available in our backyard because of this crisis. Much of the community organizing is of this kind, and I think they can provide experimental labs to study this phenomena and apply it at a public health status. So again, 2 topics for consideration in this area. Thank you.